Hi, my name is Mike Abdallah. This is my pre and post simulation assignment. What I did was I created a simulation for the nurses, specifically telemetry, PCU, and ICU nurses, for them to go through 3 scenarios where they would have to identify a rhythm and actually go through the demonstrate on a defibrillator the action that they would need to hopefully get the patient out of that rhythm. The objectives that I had for them were to identify the arrhythmias such as supraventricular tachycardia or SVT, ventricular fibrillation or VFib, and bradycardia. I wanted them to be able to explain the intervention with the defibrillator for these rhythms and how they would demonstrate, they needed to demonstrate how to use a defibrillator for the 3 rhythms. They would discuss during debriefing how they performed the simulation and determine areas for improvement. Explanation of the simulation prior to starting, what I did was I told them that they would only be utilizing the defibrillator for any intervention. They wouldn't need to use medication, tell me to that the patient needed to bear down, that we needed to give any other intervention other than the defibrillator. The simulation would consist of 3 arrhythmias: SVT, VFib, and bradycardia. The staff would be required to determine the rhythm and perform intervention individually. Well, the expected and the actual outcomes. I had expected the ICU and the PCU nurses to be very familiar with arrhythmias and to be able to use the defibrillator and determine how they could use the defibrillator to get the patients out of these arrhythmias. I was a little concerned because when I did this, there were just a couple ICU nurses, but some PCU nurses that had difficulty, more PCU nurses that had difficulty with the kind of maneuvering of the defibrillator. So the telemetry nurses, I assumed, would be hesitant to identify arrhythmias, which most of them were, so that was positive. That was what I thought would happen. However, there were some that were able to not only identify the rhythms, but actually were more comfortable to use the defibrillator. So what I learned from this was to never assume. As I become an educator, I will not make assumptions about the staff and what they do know and what they don't know. One thing, I had one nurse who was very confident, telling me what she would do. And then when I actually went through the simulation, she had difficulty with the sinus bradycardia and even how to set the defibrillator into the pacing mode. As I suspected, and I just said about assuming, but I know that it is difficult to remember to put the sync button on. When I taught ACLS, I know that was just something that always came up. So I wasn't surprised that even the ICU nurses, some of the ICU nurses did forget to hit the sync button. And then once the shock was given, that they needed to recheck to make sure that the sync button was still on. Debriefing, what I tried to do was I tried to focus on the positive. I encouraged them to make comments and ask me any questions regarding the identification of the rhythm and how to intervene. I used some remediation by, one thing I did was I noticed early on that the telemetry nurses were nervous, more so than any others. So I allowed them to work as groups. And then when they actually had to do the hands-on approach, they needed to do that individually. And so when somebody needed remediation, whether it was in the group or not, they still needed to be alone one-on-one with me to do the remediation. I asked them afterwards if it was helpful and would they make any changes to the simulation. One thing that I thought was interesting was the PCU nurses asked if they could work in teams first, like I had the telemetry nurses. The other thing was that they did find it helpful, which was great. And what they did was they did ask if we could do it more often. They had said that they don't do it often in, on the floor. So that would be something that I'd like to do, especially with the tele nurses. I would do anything to try to empower them so that they can react to an RRT or a code and just get the basics done by even putting the pads on and getting the patient ready for when the code team arrives. Here are my references and 2 pictures of 2 of the simulations that I did with 2 different people. Thank you.